Hello, my name is Dr. Masi Hashemian from Park Place Dentistry. I'd like to talk to you about one of the questions sometimes I get from patients. They say they had a filling done. It wasn't necessarily hurting them before, and then after the filling started to hurt. Well, there are different reasons why it doesn't hurt before, and then when you fix it, then it starts to hurt. One of the reasons is that the original filling that you had in there was too close to the nerve to begin with, and then once you got the recurrent cavity, once the bacteria crawled underneath the filling and got closer to the center of the tooth where the nerve is, and we call it a pulp, then just that proximity alone is enough to cause irritation for the nerve. And once we fix the tooth with a new filling, then it has an opportunity to show that's irritated, and then it hurts. So if the original filling is too close to the nerve, if you have cavity that's close to the nerve, once we fix it, then the irritation has a chance to show, and basically then it starts to bother the patient. And sometimes it goes away by itself if you give it enough time. And sometimes, despite everything, the nerve just gives up, just doesn't want to cooperate, and that's where that person ends up needing a root canal. So that's the reason, one of the reasons that after a filling is done, the tooth is going to hurt. Another reason is sometimes we have these micro cracks in our tooth structure that is created as we use our teeth. Little by little, we have all these micro cracks created in our tooth, and eventually some of these could get too close to the nerve or in the nerve. And when that happens, also the tooth starts to hurt, and that's when people complain about having toothache after a filling. So all those micro cracks connect with each other, getting close to the nerve or in the nerve area, and that causes the tooth sensitivity or pain. If something like that happens, then and it doesn't go away after a few days, then you need to address that problem with a different procedure. It's called root canal. Basically, take the nerve out, keep the tooth in there to address that issue. I hope that was a good answer to some of the questions that you might have had. And I hope that you follow us with a series of videos that I'm trying to produce for your possible questions. Thank you very much for paying attention.